Priya and Sangeeta.
Hi, this is Morgan Kowalski, Program Manager for the Family Centered Care Task Force. Thank you all for joining us today. Our first presentation will be Evolution of a Family-Centered Care Program in a California Safety Net NICU. And we have Priya Jegatheesan. She graduated from medical school in India and did her neonatology fellowship at UCSF, excuse me. She started her career as a neonatologist in 2005 at Santa Clara Valley Medical Center, an institution committed to the medically underserved. She advocates for a comprehensive care model with a multidisciplinary team, including peer support mothers, psychologists, educators, and interpreters, along with the clinical team to promote family integrated care in NICUs. We also have Sangeeta Mallik. She's a developmental psychologist by training who oversees the peer support program in her family-centered care program for NICU families at Santa Clara Valley Medical Center. Her research interests lie in studying early childhood developmental outcomes in at-risk populations and strengthening peer support programs in NICU settings for family. Thank you both for your hard work. We're looking forward to your presentation. Take it.
Great, thank you, Morgan. I'll go ahead and share my screen. Can everyone see your screen and hear us? Okay, great. Thank you for that lovely introduction, Morgan. And thank you, Mallik and your team, for giving us this opportunity to share our work from Santa Clara Valley Medical Center. I am fortunate to have a great team here at Santa Clara Valley Medical Center, and today's presentation will be a combined presentation with me and Sangeeta. And really, it's going to be representing the work of our NICU as a whole. We're fortunate to have a great Santa Clara Valley Medical Center family-centered care team that includes Sangeeta as the director of the program. We have 3 great family support specialists, and I'm happy to see all 3 of them present today. Jennifer Godfrey is in the room with us, and I see Caitlin and Patty Meyer, who are also logged in to this meeting. We have a family education specialist, that's Erin Saucedo, and both Laura Burrito, who's also here today in this meeting, who's our NICU nurse manager, and myself as the director are very involved with are part of the FCC team. Our objectives, I want to start with acknowledging everyone that has been integral to our program here before the end of the presentation. So we're grateful for our families and babies who are born at Santa Clara Valley Medical Center, O'Connor Hospital, and St. Louis Regional Hospital, which are all the other sister institutions of our healthcare system. We have a great NICU staff and maternal child healthcare team staff at Santa Clara Valley, O'Connor, and St. Louis, who are also been extremely helpful in providing family-centered care to all our infants in our institution. We have a great family-centered care team. We've been fortunate to have funding support from Valley Health Foundation from First 5 Santa Clara County and March of Dimes as well. The objectives of our today's presentation is really to describe our journey of family-centered care program in our institution, and also highlight how the FCC team now is an integral part of our NICU care and decision-making. Before we move on, we are one of the safety net hospitals. So I want to describe what do we mean by safety net hospital. A safety net hospital is one that provides a significant level of care to low income, uninsured, and vulnerable population. There's a commitment to provide access to care for all people with limited or no access to healthcare due to socioeconomic circumstances or insurance status or due to complex health conditions. From that description, Santa Clara Valley Healthcare System is really one of the safety net hospitals. The mission of Santa Clara Valley Healthcare System is to provide high quality, accessible healthcare and service for all persons in Santa Clara County, regardless of their socioeconomic status and ability to pay. One of our motto is our healthcare system's main motto is to promote better health for all. We have 3 hospitals and multiple satellite clinics associated with our healthcare system. At Santa Clara Valley, we have a level 4 NICU. At O'Connor Hospital, we have a level 3 NICU. And at St. Louis Regional Hospital, we have a newborn nursery. Between all 3 institutions, we have a total of 4,500 deliveries, which covers about a quarter of the Santa Clara County births right here in the Silicon Valley. A quick overview of our NICU. We are a level 4 NICU. We have 300 to 350 annual NICU admissions. We are a 40-bed NICU. We have a lot of staff, including 6 neonatologists, 5 NPs. We have pediatric hospitalists, medical students, pediatric resident physicians who rotate through our NICU as well. We have a large number of more than 90 nursing staff. We have more than 15 respiratory therapists, lactation consultants, physical therapists, music therapists, as well, who are all integral to our function in our unit. We also get about 50 transports a year, mostly from our own sister institutions, but also from other local hospitals. Quickly to go over what do we mean by family-centered care in the NICU. I think for us, one of the main themes of family-centered care in NICU means, the parents or the family to be able to parent their child while the baby is in the NICU, which means the parents are actively participating in daily newborn routine care. They are able to provide positive touch and skin to skin, all the important neuroprotective strategies that are key to promoting optimal development of the newborns, and where parents' concerns can be heard, where their cultural preferences or family preferences are understood, and where they are recognized as important partners in the care of their newborns. Promoting shared decision-making model by really building partnership between the families and the healthcare team. Our focus is to decrease parental anxiety and stress level while the families are in the NICU, but also prevent or decrease PTSD later on, which has been shown in literature. Are also to improve family experience while they are in the NICU, and to improve families' long-term outcome by promoting early bonding and caring for their children. The specific goals for our family-centered care program was to make sure we have peer support for all our families, to have our family-centered care team be really reflective of our patient population, to have paid positions for our family-centered care team members, to have the team as an integral part of our NICU clinical team, and importantly, to secure sustainable funding so that we can continue this program in our institution. I'll hand over the presentation to Sangeeta. Before Sangeeta starts describing our program, I'll go over a little bit of the history of how we started, where we started, and where we are now. Our very early focus on family-centered care started in 2007 when the director and the medical social worker at that time actually submitted the application for March of Dimes NICU Family Support Grant. And we were issued our March of Dimes chose us as one of the first 10 units that were recognized as NICU family support site across the nation. And the main focus of this grant was to promote family education, staff education, family-centered care, and improve patient experience. After that, in 2012, we were fortunate to hire our first family support specialist with extramural funding, who was to provide bilingual peer support in our unit. And in 2014, we were able to expand our program to hire our second family support specialist with primary focus on supporting our mothers with substance use disorder and or on maternal medication-assisted treatment programs who are in recovery.
X-ray in room 4 for doctors to please come to room 4 for X-ray.
Initially, in the early phases, so I almost want to think of our program as 2 phases. The early phase where we had, 2 family support specialists who were providing peer support and who were also working closely with the March of Dimes program with the guidance from the March of Dimes program coordinator as well. Later on in 2019, we were able to actually submit for grant monies to expand the program to include a dedicated leadership for the family-centered care program. Because what we realized is when in the early days of our program, the leadership, the lead of the family-centered program was either a physician, a neonatologist, or a bedside nurse, or a nurse practitioner. And unfortunately, because of our day-to-day responsibilities primarily focused on daily clinical care and at bedside, we felt like the program wasn't able to expand to meet the needs of our patients as much. And we felt that need for identifying a dedicated person whose only focus is family-centered care. And I think as you hear more about our program, our program went from having 2 individuals who are providing peer support with some activities to a really more comprehensive program, providing more support and being more actively involved in the NICU day-to-day function as well. So in 2019, we were able to hire our 3rd family support specialist. 2020, we had a family education specialist, and so on. So I will hand over the mic to Sangeeta.
Thank you, Priya. It's an honor to be present here to share our family support program with all of you. Without further ado, I wanted to emphasize the importance of peer support. As mentioned earlier, our family support specialists have walked the journey of many NICU families. And it's that, similar lived experience that forges a special bond with our families where it's a bond of trust. It's a bond of understanding, what another mother perhaps may have gone through. That is very critical in establishing key relationships between our family support specialists and our NICU families. I wanted to go a little more in depth about our team members. As mentioned earlier by Dr. Jegatheesan, our first family support specialist that was hired, Patty Meyer, is Hispanic, she's bilingual, and her baby girl, Jasmine, was born at 27 weeks preterm in our NICU. Patty has also experienced infant loss. She is deeply, deeply attuned to, what this particular population goes through, and has been a strong advocate for herself, as well as her family and other families in the NICU since day one. She was hired in 2012. One of the reasons also that we hired Patty is she knew she had experience in breastfeeding, a preterm infant. And that was also one of the reasons where we felt she was, in addition to so many different amazing qualities that Patty had and her empathy for this population, she was hired. A lot of stories are connected to each member of this team. We have only 30 minutes. It would take a long time to go through many of those stories, but I want to share one connected to Patty. Patty observed that we were doing skin to skin in the NICU. And one of the things she brought to the leadership is, why can't we have handheld mirrors offered to our NICU mothers whilst, they did skin to skin? That would offer them the opportunity to actually take a look at their child, to bond with their child, in what can sometimes be a stressful environment. And Patty was the one who brought this idea to our team. And so we bought handheld mirrors and offered it to our NICU mothers during skin-to-skin sessions. The next family support specialist on our team is Jennifer Godfrey, who's right here with us. Jennifer Godfrey is a former NICU mother. She had a 27-week preterm infant. And Jennifer had a history of substance use disorder and was in recovery prior to delivery. Jennifer is extremely passionate about providing support to other mothers with a history of substance use disorder. She has shared her experience with recovery programs in our county with many mothers. She has also toured residential programs for those mothers that were ambiguous about starting their journey to recovery. She was hired in 2019. And one of the key facets, and this applies to all our family support specialists, is that many a time our families stay in touch with our family support specialists well beyond discharge. A story connected to Jennifer that is extremely powerful is we had a NICU mother with substance use disorder that was at risk of losing her baby, and CPS was involved. And Jennifer had counseled the mother on several occasions about her journey to recovery. She had actually taken her to one of our, one of the programs, local programs as well. The mother at that point in time declined following that path and unfortunately lost her baby. Fast forward, little time forward, we found that this particular mother had delivered another baby in our hospital and that baby was admitted to our NICU. And we found out that when this mother found out she was pregnant with this second baby, she had actually enrolled herself in a recovery program, remembering all the advice that Jennifer had given. So this kind of is a story that comes full circle in describing the power of connection and having a family member truly understand and feel trust from a family support specialist. It's a story that will stay with us for a long time. Our third family support specialist is Caitlin Evans. Caitlin Evans is also a former NICU mother. Her baby girl Dahlia was a 24-week preterm infant who was born in our hospital and admitted to our NICU. Caitlin has been a very strong advocate for maternal mental health support. In fact, we had a nursing conference a few years ago where Caitlin basically impressed so many of the attendees by sharing her story and emphasizing, how she got the support that she needed vis-a-vis mental health. And she is extremely passionate and has been known to share her story with many NICU families around this particular topic. She was hired in 2022 as a family support specialist. Caitlin is incredibly creative. She has created skin-to-skin brochures for our NICU staff. She's been involved with the other family support specialists in kangaroo-thons. She also chaired last year our, NICU reunion that occurred 3 years after no reunions, and we're lucky to have her. A particular story connected with Caitlin is how she supported a NICU mother who was struggling because that particular mother's baby was very ill. Unfortunately, that particular baby passed away. And a few months down the road, that NICU mother reached out to both Caitlin as well as Dr. Jegatheesan, asking for resources to help her vis-a-vis her mental health. And it, once again, is a story that comes full circle in terms of that bond, that connection and the trust that families feel when they get support from our family support specialists. So to summarize the wide range of activities that our family support specialists do, they typically try and meet our parents within 2 to 3 days of NICU admission. At that point in time, they introduce themselves and share, if they can, a self-care packet with our families, as well as booklets around NICU stay. They try and communicate with our families in person or by phone 1 to 2 a week. If the family is comfortable, our family support specialists attend family conferences with the medical team to provide support to them. They also administer family satisfaction surveys. And this satisfaction survey is administered typically 6 to 7 days after a baby is admitted into the NICU. So it's kind of an initial pulse on how the family is doing and how they feel supported, how well they feel supported by our NICU staff. And the survey is also administered around discharge time. Our family support specialists make themselves available to support our families even when their infants are critically ill or dying. We have organized days of remembrance with the blessings of our families, and have known to be present there to provide support during a very, very difficult time for our families that have experienced loss. And as mentioned earlier, they do a great job of staying in touch with our families post-discharge, as and when the families feel like reaching out. My role as the Director of Family-Centered Care is to create an environment where there's structured communication within our team. Our team meets on a weekly basis to discuss a range of issues concerning our NICU families. When necessary, we escalate, any kind of problems that may arise as communicated to us to our leadership. My job is to bring in a level of accountability vis-a-vis my team. I often communicate between our team as well as NICU staff about our work, the various range of activities that we're involved in, so people know on a pretty regular basis what the FCC team does and how it supports our families. Thank you. I'm also responsible for disseminating information to our NICU leadership. And my role is not only to improve communication, but is to expand the breadth of services that we offer, both within the NICU as well as outside. It is basically to build a program so we have more visibility and people know about our work. I'm a developmental psychologist by training, and on a personal note, I experienced loss at 23 weeks in my pregnancy. I joined the team in 2019. I'm extremely passionate about serving our NICU families here at Valley Medical Center. We have our amazing family education specialist, Erin Sosido. Erin Sosido is charged with providing education to our family in a non-stressful environment. She invites them often to our conference room on a weekly basis and teaches them about baby care, CPR training, facets of discharge teaching. But one of the most popular and amazing classes that Erin spearheads is the scrapbooking classes. Week after week, families come together in our NICU and create memories in their scrapbooks by bonding with each other, as well as with our NICU staff and family-centered care team. And this is something that Erin has done an amazing job with support as well. Patty often supports her with our Spanish-speaking families, and we're very proud of that. The basic idea is to promote connection in a supportive environment, a less stressful environment. Erin Sosido, by the way, is a former NICU nurse, and we were privileged to have her join our team in 2020. I'd like to talk a little bit about the challenges our team faced during the COVID-19 pandemic. At that time, it was very clear to us that we as the FCC team could not meet our families in person in the NICU. The policies around parents visiting, and I use this term in quotes because in our minds, our families are not visitors, but obviously there were constraints in terms of the number of people that would come and spend time with the babies. It became much stricter in the NICU during the pandemic. Translation support was also not offered in person, and our beloved scrapbooking classes were put on hold. The way we pivoted during this time is we decided that we would connect with our families via phone every week. And when it became all right for us non-essential workers to be allowed in the NICU, we tried to meet the families once a week in person. We did a pretty great job communicating the changes in visitation policies with our families. And they went through several changes over the course of the pandemic. So we would keep all our families abreast of these changes, and sometimes even advocate on behalf of many of the families that were dealing special circumstances. One of the key issues that we have advocated for relentlessly in the NICU is to provide support to our families that have, that are non-English language or of non-English language preference. And we have advocated for phone as well as iPad translation services being offered to those families. Our on-site parent education classes led by Erin ended up being held twice a week following social distancing guidelines with masking during the pandemic. What we do with our NICU families is we attempt to change the nature of their family experience in what can be a very stressful journey by sharing lived experience, by providing them with encouragement, emotional support. What our team does is essentially let them know that there are staff members here that are here to support you every step of the way, although the journey may look scary and frightening oftentimes. We do several activities to enrich the family experience in the NICU, and this is a list of many of them. We organize holiday family activities throughout the year. We host picnics for NICU staff as well as our family members. We plan annual NICU reunions. We offer weekly scrapbooking classes for our families. I'll talk a little more about the Wall of Hope, which is an amazing source of inspiration for many of our NICU families, where we have the story of a NICU birth and how a baby survived and thrived through their journey in the NICU. We have these stories adorning the walls of our NICU as the Wall of Hope. We participated in readathons as well as kangaroo-thons to support our NICU family members. And here are some pictures. A picture speaks 1,000 words. And these are some of the activities that the FCC team, has organized for our NICU families. As recent as, end of last month, we had a New Year brunch for our families where they got together and, with other staff members and relaxed and bonded with each other. We have holiday activities around NICU families. Patty Meyer is so talented. She produces the most adorable, creates the most adorable onesies with, different holiday decorations. Each family member was provided a onesie for their baby. We had family members creating gingerbread houses. This was in early December. And you could see the happiness in our families in getting away from the stress and bonding with each other, opening up to NICU staff. Here's our Halloween celebration picture that we had earlier last year. We threw a Mother's Day tea party for NICU mothers, got them away from the bedside, gave them treats. They connected and learned from each other. Valentine's celebration, once again, adorable onesies were created. Lots of arts and crafts for our families were offered, and treats. And the NICU picnic that we had held right outside our grounds here in the hospital for our family members as well as staff. I'm particularly proud of talking about our NICU reunion that was held August 26th of last year. This was a reunion that was held after 3 years of no reunions. I'm also would like to mention that we collaborated beautifully with the nursing team at O'Connor NICU, were fabulous. And Caitlin Evans chaired this particular initiative, but got lots of support as well from NICU staff here at VMC and our family center care team. We had over 300 attendees join us that afternoon. And there were all kinds of activities, soft play areas. There was face painting, there was music, a petting zoo. And you can tell that families just had a great time connecting with each other, seeing the nurse that looked after their baby once they were in the NICU, or wanting to talk to the neonatologist or the family support specialist that held their hand through this journey. Here's a picture of a NICU scrapbooking session in our conference room. One of the things that we, as mentioned earlier, that we have done is provide also emotional support to our families that have experienced loss. This particular picture is from a Remembrance Day that the FCC team had, basically held in honor of a baby that, a mother that basically lost her baby. And you can tell it was a very emotional experience for the mother. This was planned in conjunction with the mother's advice, and both the parents as well were in attendance, and their families, as well as NICU staff. There were doves that were released. It was a very solemn yet beautiful ceremony to remember the special soul in this particular instance. So I wanted to make sure that, people knew that we offer this as well, if the family is amenable to it. This is an example of our Wall of Hope. This particular write-up is about Jaslyn Meyer, Patty Meyer's daughter. We worked in collaboration with the March of Dimes to create write-ups of the amazing journeys that our NICU babies have been through. And these particular, stories adorn the walls of our NICU. The hope is, as parents walk through our NICU and they read these stories, that they are filled with support and hope for their own journey, for their own particular child's journey. And so this is something that we're extremely proud of. A lot of work went into creating the Wall of Hope here at our NICU. In addition to all the support we provide our families directly, we participate in NICU clinical and QI work as well. For example, we attend clinical rounds and multidisciplinary rounds on a weekly basis with the rest of the NICU staff. We liaise regularly with our NICU social worker to support our families, and in a very timely way, family feedback is provided to medical staff as and when we get feedback from families, or there is a particular family that reaches out to us sharing a particular experience that we need further support with. I mentioned earlier about our satisfaction survey data collection. We consider the voice of the NICU families in a sense. And we've supported staff in creating skin-to-skin brochures, readathons and candle-athons, as mentioned earlier. In terms of the work we do vis-a-vis unit improvement activities, we, as mentioned earlier, have really helped NICU staff address language barriers. Knowing the population that we serve, it was very important to us to advocate on their behalf. Also, another issue that was of importance is addressing the education needs of our families and spotlighting them to our NICU staff. We have many families that do not read English, they do not understand English, or for that matter, may not even know how to read. How do we address information exchange in those particular scenarios? I'm proud to also mention that this year we established our NICU Family Staff Advisory Council. We have 7 NICU family members that graduated that are part of this particular council. We also have several NICU staff members, and we meet with them every 2 months or so to glean feedback on how to ameliorate the family experience for our NICU families. And we also, educate staff on appropriate ways to communicate with and about our NICU families, understanding the trauma that they've been through. Another issue that was also brought up was the importance of providing daily updates to our families. In 2022, we established a Voice of the Patient panel to engage NICU leadership, to raise awareness around the gamut of the family experience. And the idea was to create a culture of respect for our families. We had 3 former NICU family members that connected with the FCC team over a couple of Zoom calls. And they are the ones that gave us feedback over the exchanges that we had on how to address language barriers with NICU families, as well as keep families informed and get regular updates from providers. We're also involved in staff education. There's the informal education piece. We remind clinical care team of the trauma. We advocate, for non-English language preference families, and also ensure that when, documents are provided to our, families, is it appropriate given, their struggles, with the language or their education levels. In terms of formal education, we share educational videos on trauma-informed care, the family perspective, as well as staff burnout. We are so tuned into how hard our NICU staff work in the service of our families and our babies. And I think the most important thing is to understand that it's okay to say that, address issues like burnout and talk about it in a safe setting. And of course, the satisfaction survey reports is something that we also on a regular basis update our NICU staff about. Aside from all the work we do in the NICU, we are engaged in a community of learning outside of the NICU. We have traveled to several conferences, such as Vaughan, Cannes, Ravens. We participate in statewide collaboratives. Jennifer Godfrey is a member of the CPQCC Family Advisory Council. We are part of this amazing group, the FCC Task Force as well. We regularly attend and provide our feedback. And both Jen and Patty, part of the CPQCC subcommittee, where they have, actually shared, in work groups, how they support non-English language preference families, as well as support mothers with substance use disorder. Here is a screenshot of Jennifer's video that was included in a recent March of Dimes grand rounds around breaking barriers for burnout, strategies for supporting NICU staff. Jennifer shared a very moving story of how she was so well supported by Patty Meyer when she was a NICU mother. And in a sense, that support, encouraged her to reach out to Caitlin when she saw, Jennifer was, after discharge, was visiting our NICU a few months down the road, and she saw Caitlin, whose baby had just been admitted into our NICU. She reached out to Caitlin to support her. And it was, a lovely snippet that was shared in this particular grand rounds. This is a playful, slide about our three amazing family support specialists. This was an award that was given to Caitlin, Patty, and Jennifer last year by the March of Dimes for being the most creative in the way they support our NICU families. And I cannot speak enough to how talented and compassionate and amazing, these three family support specialists are. As a team, we also need training. We need our skills to be upgraded as well, given the work that we do. So the FCC team has been trained on customer service internally in the hospital. We get a lot of information from our family support specialist, who is part of a family advisory council. She's a member of the CPQCC Family Advisory Council, so Jennifer will bring back information to us. It helped us create an amazing Family Staff Advisory Council itself. And we also have offered training to be a patient family partner to our team, family support specialists. And now I'll hand over the baton to Priya to talk about funding support.
I want to keep a quick, how many more minutes do we have for getting Mallik?
So I believe we had you slated to speak until 2:45, but we can certainly give you another 5 minutes or so if that would be helpful.
Great, thank you. So I'll quickly,
Thanks.
one of the things that we're often asked is when we share our work, like, how do you do all this and what is the funding support? I think key is building partnership with your foundation, if you have a foundation associated with your institution, but also reaching out to other nonprofit organizations who may be available for support in your county or in your city or from state. So our funding actually started, the March of Dimes NICU Family Support Grant application was not necessarily to fund a position, but it started with in-kind support application where they were giving us all the booklets and some of the materials to support our families. And also there was a kiosk that provided some family education that was given to us as part of this fund. In 2009 was our first grant that supported Patty's position, and it's from our first 5 of Santa Clara County. And it's a nonprofit organization, and we shared the same vision and mission, so we were able to apply for the grant. And this grant gets renewed mostly annually. Sometimes we can go for a 3-year period as well for renewal. We actually continued, and many of our work, like the expanding the program, really came from showing, what it meant for our families, the support that our FCC team provided. So over the years, we were able to really secure more and more funding to include the third family support specialist for the director role and for our education specialist in 2020. Now, just like any funder, anytime you get extramural funding, one of the things is it comes with, providing them with information that that says that their money is being utilized in a valued way. Now, for a program like family-centered care, it's hard to have like an outcome per se that is easy to show, but we have we submit data quarterly and on annual basis. Some of the data is process measures, really showing like how many families were supported by our FCC team. We have a neonatal abstinence syndrome report where we actually tell them how many babies are born exposed to substances in our system, how many are admitted to NICU, and so on. And then we do provide success stories. I think the qualitative information that comes from our families, sharing their thoughts on how they were supported through the FCC team has been also very powerful. And then we have our regular satisfaction survey that we submit. Demographics report, for our funder here, they're keen on, what zip code our families are, which families are we supporting. So we provide the race, ethnicity, zip code, and the language of our families that are supported. And this is an example of our NAS report, essentially showing how many babies were born who were exposed to substances, how many of them are admitted to NICU, what % of NICU admissions were exposed to substances, and what kind of substance they are exposed to, and so on. And the success stories includes like quotes from our families. This is one quote from a 25 weeks mom that said, after my experience at the emergency department at the other hospital, I felt rejected and traumatized. And this is her speaking about one of her previous experiences. After talking with you, the nurses and the staff at this NICU, I felt so much better. And this was a quote that was given by a parent to one of our family support specialists. Again, this is a family satisfaction survey that has 12 questions asking about, how were you treated? How was your front desk staff? How did they talk to you? Did the nurses keep you included in the care of the baby? How did the doctors treat you? Did they show respect to your preferences? And so on. And our goal is to always have very satisfied answers. And this is something, again, the FCC team administers this survey because we feel like the families are more open to sharing their true thoughts to the FCC team, and they compile this information and present it to us on a monthly or at least a quarterly basis. Future directions of our program, I think, our team, based on the voice from the Family Advisory Council, they are going to work on a welcome video for our families. We are really focusing on formalizing some of the staff training for our FCC team. All our peer support specialists are interested in going through the lactation educator class, which I think would be amazing for our families. NICU peer mentor program training is something we're looking at to help have our staff go through that training. And one of the biggest tasks that we are now working on is really converting the grant-based roles that our family support specialists are now on, or the whole team is on, to convert them to really coded positions or county hired positions so that they become integral part of our NICU, just like how we have the institution hires nurses or doctors. We want the FCC team to be an essential worker, not a non-essential worker that's dependent on external funding. So that's really our future goal, and hopefully we'll get successful. So take-home message for us from our program is, peer support is free, leadership buy-in is essential, and really working on funding support for paid positions for a safety net hospital, because our families can't afford to come back and volunteer their time. If we think this role is so important, we need to make them funded positions. Program building, we do believe that you need dedicated staff who focuses on the family supports, family-centered care, because I think when our experience from having either the director or the nurse or the a neonatologist or a nurse practitioner, we all have so many other responsibilities. The program doesn't get the necessary attention that it needs. And it really, I think our team now has shown us like, we can do so much better for our families as a whole team than, our traditional model of clinical team working by themselves. Integrating the whole FCC team as part of a clinical team is essential. We want to make sure we always have the voices of the NICU families heard in all our meetings. And the QI activity really now, most of our QI activity is informed by our FCC team as well. This is a quote from Jen. The memories of this place and what the staff did for me truly hit me 6 months after discharge when your baby is hitting their milestones and they're starting to become healthy. You look back and realize how much hope the NICU gave you. The stories that I heard from my family support specialist and other mothers and the encouragement that I received from the NICU staff was so profound when I got to the other side. I realized how much they carried me through that time when I was in the NICU. So this is Jen's quote. And, again, we are so fortunate that now Jen has come back to be a family support specialist. And we've learned a lot from each and every one of them, Patty, Caitlin, and Jen. Thank you.
Thank you both so much. What a touching presentation. It's really neat to see how you celebrate your NICU families. And there are a ton of questions in the chat about how these principles can be implemented into others' local centers. We'll go ahead and collate those for you both and send an email post-webinar with your answers if possible. I'm going to go ahead and hand it right over to Colby to introduce